This week, we are continuing to talk all about artificial intelligence. Whether you use AI, maybe you know nothing about it, or you're just curious and want to learn more, we've got you covered, because over the next 4 days, we're talking to lots of AI experts right here on our show. Today, we're focused on AI and health as more and more people look to AI for their medical questions. Every day, more than 40 million people ask ChatGPT Health a health-related question, according to its creator, OpenAI. So OpenAI just rolled out ChatGPT Health. It's a hub where you upload your medical records, maybe your lab results or your notes from your latest doctor's visit, and then you can ask AI questions. ChatGPT Health does not diagnose, it does not treat you, but it can help you maybe prepare for your doctor's visit, navigate health information, analyze test results, and connect you to wellness apps. Let's bring in Dr. David Leibovitz, co-director of Northwestern's Institute for Augmented Intelligence and Medicine. Doctor, thanks for being with us.
Thank you. Happy to be here.
So when it comes to ChatGPT Health, you have your pros and you have your cons. One of the cons is when you voluntarily upload your medical records, you don't get the same protections that you would get at the doctor's office. Can you elaborate on that a little bit?
Right. When one sees a physician, these records are very carefully guarded in terms of preserving patient privacy and confidentiality, who can access them. And there's access logs created, so we know everyone who touches a record. When one, as a consumer then, not with the patient safeguards, uploads medical records to a third party, you don't have those protections. So I have a number of concerns from the privacy perspective.
And a big question is the information that you might be getting on ChatGPT Health. Is it accurate? Can we trust it? And also, when do you think it can be useful? Like, what's your pro with this?
Yeah, so I think there's tons of pros. I think the prospect of these tools at democratizing healthcare, in a sense, giving more access to reliable information, I think there's tremendous potential here. I use it often in coding applications and in other academic research, and these tools are simply amazing. That said, we have to be careful on the patient side how accurate when we're dispensing potential medical information. So a pro is it's trained on tons of information, knows a lot, and in the right setting and with the right safeguards can actually provide reliable information. We still have a lot of questions, though, about how this is structured and the quality of the information and kind of the evidence behind its use in this context.
All right, Doctor, I'm going to try to get to two things really quickly. One is another talker in the AI world is Microsoft just launched an AI tool that claims it will be able to diagnose patients 4 times faster and more accurately. What are your thoughts on this type of use of AI?
Yeah, I think, again, access to reliable information and making it easier for people to have access, given access issues with getting in to see a physician, is often there. I think the potential for pulling together threads, identifying something that might have been lost in a medical record and making the connections is where these large language models can actually do a great job. So I think there's tremendous potential. This is still unproven, and we need to be very careful before advocating use in this regard. In academic settings and from a research perspective, these tools are great to explore and then create a safe path for patients.
Really quickly, let's get to open evidence. You say it's kind of like a physician's AI co-pilot. What is it? How are doctors using it right now at Northwestern?
Yeah, so there are large language models that are grounded on the real evidence that exists. So they can summarize things effectively and report back. Even with these tools, it's important to have a high level of sophistication and be skeptical and validate information. These large language models are still subject to hallucination, but physicians are using these sorts of tools often, hopefully carefully, and validating information they retrieve. But it can also recall memories that physicians have to help them make the right decision and also link to the evidence. So one always wants to be able to link back to the source and validate it when there's any questions.
Yeah, validate, validate. Dr. David Leibovitz from Northwestern, thank you so much for your time. I appreciate you walking through so much of this with us. Thank you.
Thank you.
And still to come in our Eye on AI, here on our show, we examine how doctors are currently using AI during their appointments with patients at UChicago Medicine. We explore how it's helping with burnout, but also the privacy concerns raised there as well. We'll get to that a little later in the show. Well, as we continue our Eye on AI week, pressed for time, overworked, and burned out. We're talking about doctors who are seeing more and more patients, and they're turning to AI to help them. 2 in 3 physicians said they use AI in 2024, according to the latest data from the American Medical Association. Locally, we're zoning in here on the University of Chicago Medicine. Doctors are using AI technology called Ambient. Basically, it's a note-taking tool. It records patient visits. It writes detailed notes for the doctors. So how can that help? Well, studies suggest that ambient AI saves time. It can reduce burnout. At UChicago, their clinician burnout dropped about 52 to 39% after just 30 days of use. And across the country, burnout rates dropped 30% for doctors using this type of AI, according to JAMA Network Open. So let's dig more into this. We've got Dr. Sachin Shah, UChicago Medicine's Chief Medical Information Officer. Dr. Shah, thanks for being with us.
Good morning. Thanks for having me.
You're the perfect person to talk to here because you actually helped roll out ambient AI at UChicago, and you say it allows you personally to turn away from your computer screen and connect with patients. Can you talk about more about how this is helping?
Yeah, it's a really great support tool. It's a lot of the reasons that we go into medicine are to connect with our patients. Unfortunately, for a long time, the electronic health records, the computer screen is often an incursion into that relationship. And the tools like this that offload some of those administrative responsibilities, the note taking, the clerical work, it allows us to really be much more present and lean into that conversation, which is I think what we all want.
Yeah, we want the conversation with doctors for sure. But I know safety and security around patient data is, of course, super important. And we're in a 2-part consent state. So right now, you do need verbal consent before Ambient records the visit. What happens with the recording, and how are you guys navigating those privacy concerns?
Yeah, it's a great question. Sometimes the technology kind of outstrips the pace of the policies and the security concerns. So we've been really thoughtful about that. We've really involved our privacy team, our security team, our compliance team, and our patients to make sure that we're completely transparent about when we're using it, why we're using it, and making sure that our patients are on board with that. When we explain it, to say that, hey, I want to use this because that lets me focus much more on you and in our conversation and not on this computer screen. I think most of our patients are really willing to have it, and they welcome it because it just makes that experience much more better.
Yeah, and people feel so many different ways about AI. Right now, this particular program is optional for doctors at UChicago, but you said you have about 50% using it right now, so about 1,000. Do you anticipate more using AI this year? What's your outlook?
Yeah, there's this adoption curve that I think a lot of us are familiar with. There's a lot of early adopters, and we got most of those are using it. There's sort of the more general population, then there's the laggards. What happens is if it's a good tool, if it's working well, and we've been studying it rigorously to show that, and to prove to ourselves and to our colleagues and to our patients that it is an impactful tool and it's a positive addition to medicine, to healthcare. I think the doctor that looks to his left and looks to his right and sees that his colleagues are going home a half hour, 40 minutes before they are, I think they start to pay attention and say, hey, maybe I should, I know I've been a little resistant, but maybe I should check this out because I think it could make my life better.
Yeah, I'm glad you guys have seen burnout rates decrease there at UChicago Medicine. Dr. Sachin Shah, thank you so much for being with us. We appreciate it.
Thank you so much.